Hello, my name is Georgia Peck. I'm a news reporter for Tiger TV. I'm just going to have you introduce yourself.
Hi, this is Dr. Joe Kanter. I am the State Health Officer for the Louisiana Department of Health. I'm also a practicing ER physician, and I'm a key advisor to Governor Edwards on the COVID response and right now the vaccine rollout.
Awesome. So I'm just going to ask you a few questions and a few concerns that college students have about the vaccine. So the first one is, can you explain to me the different types of COVID-19 vaccines that you can get and the differences between them?
Yeah, so right now we have authorized in the US three different types of vaccine, which fall into two different categories. So we have the Pfizer vaccine and the Moderna vaccine. And these are really cousins. They're very, very similar. Different companies make them, but they work very, very similar. They're a relatively new platform for vaccines called mRNA or messenger RNA. Not a new technology all told, because we've been using mRNA technology for cancer therapeutics for years. And actually, after the SARS pandemic, which was a type of coronavirus as well, a lot of money and research went in to these type of messenger RNA vaccine platforms, which happened to come to fruition right around COVID. So it really was fortuitous. It's a very clean vaccine type. It doesn't involve using a live virus as the host. It involves a little bit of genetic material that teaches your body how to produce a copy of a particle that looks like COVID, so that your body can learn that and then start building antibodies to it. Going forward in the future, there's going to be a whole lot of more vaccines made this way, because these have been highly successful and they're very, very safe and have really good side effect profiles. The only real differences between the Pfizer and the Moderna are the Pfizer is a 3-week series, one dose and then another dose 3 weeks later. The Moderna is a 4-week series. Both of them are 2 doses. That's one difference. One other difference is the Pfizer is a little bit harder to store and transport. It needs to be kept under ultra cold conditions, which is negative 60 to 80 degrees Celsius, which is pretty cold, not normal for vaccines. Moderna is a little bit more routine. Beyond those two things, in terms of how effective they are and how safe they are and their side effects, almost identical. We have a third vaccine, Johnson & Johnson. This is a single dose vaccine, one and done, and it's a more traditional vaccine. It's made off of an adenovirus platform, which is a type of common cold adenovirus, and they use that as a vector. It's attenuated, so it can't replicate in your body. It can't make you sick. It's a much more traditional vaccine, and people really like it now because it's just one shot and you're done.
How long does your immunity last after you get the vaccine?
It's a great question. And the answer is no one knows. No one knows, because the only way to know this is to study people that have gotten the vaccine over time. And there just hasn't been all that much time so far. We know for now that these vaccines give you good protection for 6 months, because that's the duration that they've really been studied so far. Doesn't mean that they end up for 6 months. It just means at least 6 months. The only way to know for sure is to continue watching over time and seeing if people who got vaccinated start to get infected after that. It's definitely possible that we might need booster doses like we do for other vaccines, other diseases, but we just don't know yet.
Can you still get COVID-19 even if you get the vaccine?
You can. It's really unlikely. It's very rare, but you can. So I'll tell you, um, almost 2 million, well, actually more than 2 million now, shots in arms have been given in Louisiana. Of all of those, we have 170 people who we call breakthrough cases, which are people who have been fully vaccinated. We consider fully vaccinated to be 14 days or longer after you finish the series, and then got COVID afterwards. 170 out of everyone, that's 0.02% of everyone that's got vaccinated. And half of those 170 were asymptomatic, tested positive, but had no symptoms. The bottom line is this: no vaccine is 100% effective 100% of circumstances. These are pretty close, pretty darn close, but of course not 100%. There's always going to be some breakthrough cases. Normally they're much less severe. And this really is why herd immunity is important, because there will be some breakthrough cases, and because some people can't get the vaccine. Some people have medical conditions or allergies and they can't get the vaccine. we have to make herd immunity, which means more people in the community have to get it to protect all of those other people.
Is there any proven link of the vaccine to causing infertility, and why are people thinking this?
There's not, and it's pretty crazy because this has become a real myth, and it's really unclear where it started, but it's done a lot of damage because it's discouraged a lot of women, young women, from getting the vaccine, which is a shame. So we should talk about it for a second. There's absolutely no evidence, nothing to suggest that either of these three vaccines have any effect on fertility. And I'll go deeper than that. There's no plausible biologic mechanism, which means that there's nothing in how these vaccines work that would make scientists suspicious that they could do that. And on top of that, we now have a lot of experience. Nationwide, there's been about 170 million vaccine administrations across the country. A lot of data to look at, and there's absolutely no suggestion that it has any effect on fertility. It's a myth. It's a myth like other, fake news things that kind of get thrown out there, but it's really been harmful because it's discouraged a lot of women from getting it. On the flip side, and particularly for women who are pregnant, we know what COVID does to you if you're pregnant. It puts you at higher risk for miscarriage, higher risk for preterm labor, and higher risk for maternal complications. We already lead the nation in maternal mortality. We don't need any more of that. We know what COVID does. This vaccine appears to be very, very safe in pregnancy. There's actually a registry right now that the CDC maintains called vSafe, where pregnant women go in and register so that they can track the progress through the pregnancy. They currently have 77,000 pregnant women being tracked through this, and there's been no suggestion at all of any adverse effects from the vaccine. So people should really try and not listen to myths like this because they're really, really, really harmful. And I get really discouraged when I hear people that don't get the vaccine because they kind of fell victim to a myth like this.
What is making people think that this is something that is true? Like, why are so many people adopting this mindset about the vaccine?
It's a great question, and I really don't know. It's hard to answer. Sometimes these myths get out there and they just perpetuate. On a larger sense, though, I get it. COVID has been confusing. It's been politicized. I mean, the entire duration of COVID has been politicized. And so it makes people wary and question. And I think that's understandable. And I think it's good and natural to have questions. I just want to make sure people get connected with the right information, for those questions. When we talk to people who might be labeled as vaccine hesitant, which I don't like the term because it's not yes or no, it's really a spectrum. But when we talk to people who would be labeled like that, I'll tell you what we don't hear. We don't hear people saying, I'm never going to get it. It's really rare to hear that. What we hear a lot of is people that have questions. I don't know. I'm not sure. I'm going to wait and see. I think that's a very natural response. What we have to do is make sure that people have an opportunity to ask those questions and have them answered.
What would you tell people that are scared to get the vaccine because of how new it is?
Yeah, it is. I'll tell you, it's miraculous. It is the best way I can say that these vaccines were produced as quickly as possible because every day people are dying from COVID. I mean, 15 people dead today was our number, and we're not even in a surge in Louisiana right now. So every day we're counting more and more deaths. So it really is a gift that we have these. The bottom line is the reason why these vaccines were produced quickly is because a lot of red tape and bureaucracy was cut. No corners were cut, particularly in the safety and the trials for this. None at all. Just a lot of red tape. So one of the ways the federal government did that is typically when you do trials for a vaccine, you do one step and then another step and then another step, and you wait until one to finish before you move on to the next because no one wants to make a financial investment on one part of it if it's never going to get there. This was different because people were dying all the time. So the federal government paid actually for companies to start producing these vaccines while the trials were still going on. Now, you would never do that in normal times because if the trials turn out to be no good, you lose that money. You'd have to throw it away. But it was a bet, an investment worth taking, and it paid off because the trials, at least for the three we have now, turned out to be very good. And by the time those trials were done, the companies had a head start on production. All types of things like that happened during this. The FDA is very rigid. These groups did very thorough applications, and the trials for each of these three vaccines were big time trials. We're talking 40,000 people for each of those trials, major time trials, which show that these vaccines not only are very effective, but very, very, very safe. So I feel very confident in the vaccines right now. I understand why people have those concerns, but you got to understand that if every resource was brought to bear with these vaccines. A lot of money was thrown at it, a lot more money than normal. And that's really what allowed it to be produced so quickly.
How long should you wait before starting the vaccination process over again if you can't get your second dose on time?
You don't need to restart the series. If you can't get your second dose on time, just get your second dose as soon as you can. The CDC has looked at this. The CDC has said it's super, super safe to wait even 42 days after when you should get your second dose. You can wait longer than that. We just don't have efficacy data after that. But there's no need to restart the series. You usually want to get that second dose whenever you can. Life happens. Everyone gets that. If you have to push that date back a week or two, it really is no problem. Just get it done when you can.
Will your reaction to the vaccine be worse if you've already had COVID-19?
Yeah, it's possible. It's very possible. We're seeing that. Not terribly worse. I mean, most people have very mild reactions. I can tell you, I got the Pfizer vaccine, and for both of my 2 doses, I had a sore arm and I had kind of a low grade. I felt crummy that night. I woke up with some sweats, once both of those nights. Probably had a low grade fever, although I didn't check my temperature. And then by 24 hours in, I felt fine. That's very common. That's what most people have. Some people have absolutely no symptoms at all. I think you're a little bit more likely to have some symptoms, like what I had, if you were exposed to COVID prior, but it's not absolute.
Are there any known long-term effects of the vaccine at this current point?
Nope. Nope. The only long-term effect, and again, long-term meaning 6 months, is that's what we have the data on right now, is that you're much less likely to get COVID. And if you do happen to get COVID, you're much less likely to get sick. And you're much less likely to transmit COVID to someone else if you have an asymptomatic infection. No long-term effects that have been known. And look, by this point, there's been so many doses given across, 170 million doses across the country. That's more than enough to see a pattern, if there was a pattern of effects out there, and there just is not right now.
That's all the questions I have for you, unless you have any additional comments about anything.
I would just say, we have reason to be encouraged with COVID because the numbers are going down in Louisiana and we're doing quite well. But we also have reason to be concerned. And that's because while the numbers are going down, the amount of COVID that is out there in Louisiana that is comprised by this variant, particularly the UK variant or the B.1.1.7, is going up. And we know this variant is more transmissible, and we know it's more virulent, which means it's more likely to put somebody in the hospital, more likely to make you sick. It's going up and up and up. We very likely could have another surge because if this variant grows, it's going to drive other transmission. That's what's happening in Michigan right now. That's what's happening in the Northeast right now, New York, New Jersey. They're having surges because of this variant. We easily could have that. There's 2 things that we can do to protect ourselves against it. One is to do more mitigation measures, more restrictions. The other is to increase vaccinations. I would much rather do the latter than do the former. I think everyone would. Mm-hmm. Don't wait to get the vaccine. Don't wait, because this variant is growing and we very likely could have another surge. Take the time to protect yourself now. You're not only protecting you, you're protecting your family as well, because you're going to be less likely to transmit it. Don't wait. Do it now. If you wait until you get sick, you kind of lost some of the opportunity there. So take the opportunity to do it now. What has changed over the past week is we now have much more supply of vaccine from the feds. We were supply limited really up until now, but now we have a lot of supply. Let's make good use of it.
Absolutely. Okay, well, thank you so much for talking with me today. I really appreciate it.
Yeah, my pleasure.